Hi, if you have a baby that has abnormal movements, especially newborn, very important to not watch this video because it can make a huge difference in the baby's future as well. So here's what happened in children. They can have something called epileptic spasms or infantile spasms, and those are very abnormal movements and they are epileptic seizures. Like these children, look at this boy, like he will tense up and the eyes will move up, and look at this child, poor guy, like he's having those movements, and all of those are epileptic seizures and a result of very abnormal electrical activity in the brain. And it is essential to diagnose those abnormal movements and those discharges very early in life, because that makes a lot of difference in the prognosis or the outlook of this condition. So this condition is called infantile spasms, and really because it does not only occur in infancy, it is called now epileptic spasm. So epileptic spasm is an epileptic disorder that there is an abnormal discharges in the brain, and there are multiple causes for this. It can be genetic, it can be metabolic, it can be like abnormal cells forming in the brain, and so many other causes. All of those can be causing epileptic spasms, and it is essential to make the diagnosis early on because we have a very narrow window of time to treat this condition. So if this condition is not diagnosed early on and it is not treated within about, like, you're saying about 4 to 6, maybe 8 weeks, this can cause permanent damage that can be irreversible. So sometimes those movements will start and then the mom or the doctor, everyone's like, oh, those are just colic. Oh, the stomach hurts. Oh, the milk is not tolerated. Oh, they need fat-free milk. Oh, they need like lactose intolerant. All of those things are, or maybe they have a gastric reflux. All of those are wrong diagnoses until they reach to the doctor who is a neurologist, or the baby is not getting better. Then there's like, oh, those are epileptic spasms, and they can be too late to treat. If you have those abnormal movements in your child, go to the pediatric neurologist really quickly and see them emergently. This will happen, and then they will do an EEG with video to look at the movements and diagnose that. There is a signature changes in the EEG called hypsarrhythmia, and hypsarrhythmia is very chaotic brainwave activity that is seen on EEG, and this is a very important diagnostic tool that we can do. They also will do an MRI of the brain to diagnose any abnormal cell locations or a stroke or anything that is abnormal in the brain shape, and they might do metabolic workup, metabolic testing, and even a genetic testing, because sometimes there are some genes that are responsible for this diagnosis. And if we have also developmental delay, that all of them, they can combine together. So epileptic spasm, developmental delay, and hypsarrhythmia, they can make the diagnosis of West syndrome. And unfortunately, like Dr. West, who described this originally, he described this condition in his own son who had this bad type of epilepsy. The treatment is essential to make first the diagnosis, because the treatment is different than all other epilepsy syndromes and epilepsy conditions, because the regular anti-seizure medications might not work in epileptic spasms and West syndrome. There are few medications that are specific for this condition. They are ACTH, the adrenocorticotropic hormone, the prednisone, the vigabatrin. Those medications are essential and they are very important, and they are specific for this specific condition. Especially in cases of tuberous sclerosis, they will respond very well to vigabatrin. So it is essential to make the diagnosis early on to address that with those right medications, because sometimes the regular anti-seizure medications, Keppra, Depakote, they will not work in this condition, though they might be added on later. And this condition, it might be very difficult to treat. All depends on the cause of this epilepsy syndrome. It can need medications, it can need ketogenic diet, it can need even surgery in some cases. Like sometimes there's a huge hemisphere, the whole half of the brain is malformed, and then we cut all of that out so that we give the normal brain a chance to progress and develop normally. So it is essential to make the diagnosis early on. And unfortunately, this can be very difficult to control epilepsy, and then their children will grow on and go into this refractory epilepsy type called Lennox-Gastaut syndrome. And this is one of the most difficult epilepsy epilepsy syndromes, and one of the very refractory. The patients will have so many different types of epilepsy. They will have very bad and poorly organized EEG, and they will have also drop attacks and developmental delay. And there are multiple different surgical treatments that we can do for the drug-resistant epilepsy type, including some surgical resections and devices that we implant in the patient to improve the seizures. And every patient is different, and I explained all the details about the surgery and the devices one by one in this video that you can see. And stay healthy, and see you in the next one.